and we are delighted to welcome the Chief Economist of GE Healthcare, Mitch Higashi. Welcome up.
Thank you.
I bet you were happy to see that how the technology part of this was inspiring to people.
Yes.
Please tell us first, Mitch, is there anything that you would like to comment upon what's been said so far?
Absolutely. Fantastic discussion, Annika. And first of all, opening comments from the minister, just reflecting on how the relative working age is getting shorter compared to the retirement age. And I think that laddered nicely into Dr. Beard's discussion about re-challenging productivity in those later stages of what we now think of as retirement. And I think that's necessary for us to be a more productive society. And then finally, Lars Lind's comment about sustained behavior change. Because after all, if we're going to create a new healthcare system that enables healthy aging, that sustained behavior change towards prevention is vital. And I think there's an enormous amount of innovation that can be directed at that we have to yet solve for.
Great. Thanks a lot. Please tell us more.
Okay, thank you. Thank you again for the opportunity to be here. I had a fantastic walk through your beautiful city last night, the city of Uppsala, so I'm feeling very connected to this vibrant city and the purpose of our discussion here today. A very quick snapshot of GE Healthcare so you can understand how we interact with these health challenges around the world. We are a technology company. We manufacture imaging technology such as MR and CT. We're working on techniques to enable detection of disease at the molecular level. And we produce manufacturing tools necessary for biotherapeutics. We also work a lot with data. So we work with healthcare data through our healthcare IT business and also through our consulting practice. A very quick snapshot of the global healthcare economy. So last year, the world spent about $8 trillion on healthcare. $3 trillion spent in the US, about $1 trillion spent on pharmaceuticals across the world, and half that cost was labor. Okay, so $4 trillion of that $8 trillion was spent on labor. An interesting fact about labor costs. It doesn't matter if we're looking at China or the US or across the European Union, half the cost of healthcare is labor. It is, after all, a service industry. How that other half is spent varies widely, country by country, right? But labor is a significant component. That number, 8 trillion, is growing at about 5.5% per year, above and beyond the rate of inflation, okay? So we are headed towards a healthcare economy of about $12 trillion by 2020, okay? So no shortage of money being spent on healthcare. The question is, what is the value and how do we enable a productive, healthy, aging society? Whenever we read about healthcare costs, the word aging is often mentioned in the same sentence, right? So aging and elderly are seen as driving healthcare costs, as seen as a drain on healthcare productivity. Well, I first became aware of this point out in Silicon Valley about 3 years ago. A venture capitalist remarked to me, he said, by the way, most of the successful startups that we invest in are being led by people over the age of 50. And so that trend has now been quantified with research, and it's been confirmed. The highest rate of entrepreneurship has shifted to this 55 to 64 age category. It turns out, contrary to popular belief, people continue to develop through all stages of their life. And while the stage of your 20s and 30s may be marked by that great question of, can I love? Can I have meaningful relationships? The era of the 55 to 65 is marked by, can I make my life count? And that life stage is marked by productivity, by creativity, and why is it that people over 55 are almost twice as likely to start successful companies versus 20 to 34-year-olds? Well, they have experience, they have wisdom, they have insight, and they can use that to create value for society. And so the question then becomes, well, how do we enable that asset, that wealth-generating asset, that job-creating asset of this elderly population? How do we enable them and unlock this productivity within that age group? So I would propose to you that healthcare 2020, in order to meet their needs, it needs to do three things. We need to delay the onset of costly and debilitating disease. We need to extend and maximize healthy and productive years, and we need to deliver these big gains cost effectively. So delay onset, that's about early detection. Extend, maximize, that's about prevention. And can we do this all in a sustainable way? I want to offer to you three challenges. If we're going to re-engineer this healthcare system to meet the needs of an aging population, there's three challenges we've got to figure out. The first is the challenge of technology. Perhaps one of the great policy questions of the next decade is, why has not Moore's Law produced great productivity gains for the healthcare system? What do I mean by that? Moore's Law, first observed by Gordon Moore from Intel, 1965, he said the rate of our human ability to process information was doubling about every 2 years per unit of cost, okay? So human beings, it turns out, over the past 100 years, have had this doubling in our ability to process information. Every dash on this line indicates 2 years. It turns out that successive platform developments have enabled these massive leaps in our ability to process information. In fact, this is a logarithmic scale. That means if I plotted a direct line relationship, this line would go right off the screen, okay? Vacuum tube era, the transistor era, now the integrated circuit era. We're getting faster and faster to process information. What does that mean? Everything on the right-hand side of the screen from 30 years ago is now available to all of you on your cell phones. And what does that mean for productivity? Virtually every industry, manufacturing, telecommunications, banking, retail, massive leaps in productivity except healthcare, okay? One of the great technology questions of the next 10 years. What do I mean by healthcare productivity? Well, that goes to challenge 2, and that is the labor challenge. Okay, so very interesting study published in the New England Journal of Medicine. They looked at the average number of tasks that a healthcare worker in the US could perform in a given hour, okay? That number of tasks has gotten less over the last 20 years. The average healthcare worker of today can process less tests, can see less patients than they could 20 years ago, okay? There's a separate problem, a report that was issued by the European Commission projecting a flat labor supply for healthcare workers due to austerity measures, creating a shortage of about 1 million healthcare workers by 2020. So as the demographic demand continues to increase, and as the labor supply remains flat, that creates this productivity gap of 15%. What that could mean, that's the equivalent to every healthcare worker across the European Union working an extra half day per week for free. In developing countries, the labor force challenge is very different. There is labor, but there is a skills gap and a training gap. Okay, so for example, in India, they have technical support staff, but if they were to be trained properly to run all of the hospitals that they're planning to build, there's about 6.2 million of them in great need of a skills upgrade. In China, rural doctors, over half of them have only a high school level of education. So we have a cost of the labor healthcare workforce in developed countries, and we have this training and skills gap in developing countries. Challenge 3, that leads to the waste problem. This is a US study, so I won't make inferences to the European Union, but Don Berwick, former head of CMS, which includes Medicare, he published in JAMA that about $1 in every 5 of the future growth in healthcare costs will be driven by waste. Okay, low coordination, low automation. This is what technology has solved for in virtually every other industry, right? The ability for us to coordinate and work together, and the ability for us to automate those tasks that could be automated. So how does industry demonstrate the value of technology today? So this is the innovation pathway. I call this the linear model of innovation, and this is very much a 20th century model of innovation. Okay? Okay, so what I mean here is invention happens here. Often there are grants and there are inventors who are inventing products. Industry takes over in the middle box. They commercialize products and they build IP around products. But then those products get injected into systems, healthcare systems, okay? What that means is providers, clinical societies, ministries of health, they are faced with the task of catching all of this product by product innovation and then figuring out how to adopt and implement into healthcare systems, okay? So we heard some great comments this morning about systems thinking and the need to innovate towards systems. We don't want to lose a lot of the great product innovations, but I would argue that we have to do some rebalancing towards system-based innovation. When you're in a world of randomized trials, that's a world that produces data for products, right? Is product A better than product B? The randomized trial is the gold standard way to produce data. Well, we're heading towards the zettabyte threshold. Okay, the zettabyte threshold means the amount of internet data that is transmitted today is equivalent to the size of a tennis ball, okay? By the end of about 2015, that size will become a basketball, okay? In other words, we're going to have 1 million petabytes of data transmitted. Where's all that new data coming from? All that new data is going to come from here, okay? As our systems get connected, devices, equipment, and we begin to see what we're calling the industrial internet. Okay, so vast amounts of data being generated by devices and equipment that's going to create this exponential rise in health information, right? So if we have a new paradigm where most of the information and data is generated here, maybe we need to think about some new research methods, right, to tap into and get insights from that new data. And then lastly, some rebalancing and some more emphasis on prevention and productivity as a source of innovation. I think we can think about the innovation model a bit more comprehensively when we apply it to the aging society. In addition to the many great clinical targets that we are seeing innovation against today, I think tomorrow we can see more directed at operational efficiency and productivity, and also at patient experience and elder experience. There's many great benefits to prevention and early detection. I do want to mention that Professor Stefan Bevan will be talking later this afternoon about Fit for Work Europe. And they've done a great job of quantifying some of the productivity costs that are associated with musculoskeletal disease. Yesterday I was in Stockholm and I was learning from one of the county councils the excellent work they're doing with rheumatoid arthritis. And it turns out they can detect rheumatoid arthritis about 5 years before it starts to manifest debilitating and damaging symptoms, right? Ultrasound plays a key role in that detection phase, but if they can detect early and treat early and then delay the onset of the disease, there are productivity gains to society. Some fascinating new research coming out of the Alzheimer's space. So 28 million of the world's 36 million people with dementia have yet to receive a diagnosis, and yet amyloid could be present at least 10 years before the symptoms appear. And so there was this study just published in Health Affairs called Unintended Benefits. And they said, look, we know that there are risk factors strongly associated with Alzheimer's disease. You have diabetes, hypertension, cardiovascular disease, obesity, and they called them potentially modifiable risk factors. And so they said, look, if we could apply what we already know to managing these risk factors, we could potentially unlock some great gains in dementia. You know, they're very careful in this study, right, about not making causality claims, but they're saying we could potentially lower the risk, delay onset, reduce duration, and lower costs. So there are challenges for providers to invest in prevention. There's the linear model of innovation that I just discussed, and providers today are grappling with the labor productivity issue that I just described. If we take an RCT paradigm of the world, then you need really big studies to show that prevention innovation is working. And there's also this idea of budget silos. So prevention, investments in prevention happen immediate and upfront, but the benefits such as workforce productivity are realized down the road and in somebody else's budget. And then Lars Lind talked about this idea of patient motivation, right? So how do we sustain people to comply with healthy behavior? I would also say that providers are really in the best place to understand what the current barriers are and how do we motivate behavior change. So how can providers direct innovation towards healthy innovation, right? What are some new models and what are some new ways that we could think about rebalancing away from the product model of innovation, which is the 20th century view, towards something that's more systems-based? There's this issue of the new targets that I talked about. Providers can help flag, raise awareness, advocate for new sources of innovation, new system innovation that we in industry need to go after. I think the case can be made for devices and programs that enable prevention and productivity, that they could be on a faster development and approval timeline. And then finally, prizes, maps, and crowdsourcing. So I'll close with a couple of examples in this space. What are some new ideas to catalyze new ways of thinking about innovation? This is the Ansari X Prize, the first major prize awarded in 2004 for commercial spaceflight. Okay, so the prize was $10 million. Who can come up with the best system for repeatable commercial spaceflight? That has now been taken, has been acquired by Richard Branson, and the Virgin Airways has now become Virgin Galactic. They have pre-sold 640 tickets for space tourists to go on space rides. Well, the point of the prize model is it's very efficient, right? It attracts the best ideas from teams all around the world, and it pays only the winner, right? And so we're seeing more prize models come out of the healthcare space now. Non-traditional stakeholders are beginning to sponsor prizes. Qualcomm Telecommunications, they're posting a $10 million prize for a handheld health monitor. Who can come up with the best device? Heritage Health is a provider in the US. And what they're saying is, look, we have all of this big data, masses of these different big data sets. Which team can come in and develop the best algorithm to predict hospital readmissions? $3 million. And then you see a nonprofit, Michael J. Fox Foundation, $10,000 to see who can use smartphone data as a early detection for Parkinson's disease. Okay? So the prize model is an interesting way for us to think about how providers and ministries of health can get more involved in the innovation game. With the zettabyte threshold, with the industrial internet, we're going to see a lot more big data generated by providers. And so for those of us interested in designing better systems for the elderly, that big data needs to do three things for us, right? We need to understand problems, project problems, and solve problems. And so there's a lot of innovation, a lot of advances in big data analytics, both in the mapping, data visualization, the modeling, which is the forecasting part, and then games. Just make it fun and interesting for many different people to participate in solving these tough problems. This is a slide from the Kingdom of Saudi Arabia, presented in Geneva at the Ministry of Health last November. It created quite a buzz because this is a snapshot of breast cancer, okay? What they did, with some help and support of GE data scientists, is they layered together different data sets to create a map of breast cancer. Dark red means high risk of breast cancer. Small circle means limited access to mammography. Mammography is essential for the detection, for the screening for breast cancer. That dark red region up in the far right, that means no access to mammography. So that represents over 1 million women at high risk for breast cancer with no access to the essential technology, okay? So it begins to open up new potential in the data visualization space. And so let me just close with a thought about crowdsourcing, right? When we make problems like this visual, so many people can understand it, and then make it fun and interesting for different people to engage with and solve this problem, right? Drag and drop and plan. Where should new hospitals be, and how should we configure those new healthcare services to address these problems? We open up the potential for crowdsourcing. And so as a closing thought, I would offer to you that the generation coming up behind us, so for many of you, that's your children and your grandchildren, they are the open source generation. They are the crowdsourcing generation. And they will look at problems like we're discussing today, you know, these tough, challenging problems around an aging society, and they will want to see more tools to crowdsource, right? Instead of 200 people, why not have 200,000 people participating in that problem of policy design? And so with that, back to you, Annika. Thank you.
Thank you. Yes, of course, the gamification trend, where we use our insights of the reward system of the brain in a way to engage and motivate, is very powerful and not too widely used yet. But of course, and all the quantified self that devices that inspire many, of course, also give possibilities.
Important issue here. It's an issue back to Lars Lind and also an issue to Mitch in terms of the expensive technologies as against finding inexpensive, practical technologies. But let me approach the question from a somewhat different perspective, which has to do with changing the balance. You talked about a system-level structure of innovation. Will that change the balance of control such that patients and individuals are more empowered? How do you give them more authority over what happens to them in the health system? Is that part of the vision that we're seeing with innovation? And why are there no prizes for that?
Excellent question, yeah. Yeah, I mean, I think the combination of smartphones plus Fitbit plus being empowered to make your own healthcare decisions, right? Once people have an awareness of, wow, I'm empowered, I need to be an active manager of my health, plus I have my own personal devices that are giving me real-time feedback on my health, plus I have a smartphone that helps me to take information, make it accessible, and navigate the healthcare system. I think as those three things come together, we'll see this kind of upsurge in the consumer.
So we don't need Richard Branson to do that?
Correct.
Good.
Yeah, yeah.
Okay. Just checking.
We will need entrepreneurs to do that, right? We need entrepreneurs to keep innovating.
For all, I mean, the figure that I heard from in British Columbia is that there are now 97,000 apps that are health-related that you can put on your smartphone that will allow you, the individual, to monitor your various systems, that will also transmit various important functions directly to your primary care providers where they can monitor you without ever seeing you. And that there's a whole range of technology that's basically organized to focus on the individual, making changes in their own behavior, and working with a team and responding to that, which is, I guess it's systemic in a way, but it's system in a different notion, I think.
Yeah.
So, thank you.
Thanks.
The audience, would you have any questions to Mitch here concerning this? Yes, please. Would we get a microphone back there, please?
Yes, could you comment on the impact of data protection in terms of, I've heard over and over that researchers have found difficulties, for example, in transferring data. I'm thinking of, for example, multimorbidity. A patient sees different doctors in old age, and sometimes they get incompatible medicines, and how, for example, this data could be pooled because people find a lot of difficulties due to data protection laws. Thank you.
Okay. I just want to make sure I understand your question. I think I heard part of your question around the different silos of data that are captured in the healthcare system right now. And I think that that part of it ties directly into what Richard was just talking about with the different health apps. There's huge pent-up demand for people to avoid this onerous task. Every time they, at least in my healthcare system, every time you see a different provider, you fill out a different paper form. Right? And so that, if that doesn't get solved for by big industry, someone is going to write the killer app eventually that solves for that, right? And what you're going to see, what we project you may see, is this thing of an exponential uptake. So right now, the trend that Richard was describing, it's in the phase of 97,000 apps. There's some level of confusion, some level of disappointment, right? Consumer apps in healthcare have not really enabled a big convenience uptick yet. But we think that's all happening under the surface, and you make a mistake by thinking, well, we haven't seen a great consumer app yet to solve the problem you just described, so therefore there will never be one, right? But Facebook and Google and other big IT companies suggest that once that killer app comes out and then everybody adopts it and accepts it, then you see an exponential uptake. Then you see traditional incumbents in industry in chaos and confusion, right? Because this new app has come out of nowhere. It's the game changer. It solves so many of our latent unmet needs that we didn't realize, and then, right? So I think that's how it will play out eventually.
Thank you for now there, and of course we need to remember the human side of this as well. It's easy to be carried away by technology, and the low-tech human interaction is very important not to neglect at the same time. Thank you so much, Mitch, for bringing this up. Thank you.